Good morning, everyone, and happy, thankful, thriving Thursday. And it's beautiful at my end here. I don't know about you at your end, but it's beautiful at my end. Why? There is a drastic change of season. We plan to go out today to do certain things, especially on the One Global Movement farm that we were recently blessed with by this father that we
Nice.
want and keep him companion. You know, and we got up. We reserved a tiller. Now we couldn't go there. I called the place. It's Home Depot anyway. It says, "Oh no, it dropped off because you didn't come here on time." I said, "Look, the weather." The man laughed. Say, "Yup, it's not good out, and it's not just snowing; it is snowing and raining." For you
Ah,
guys to know how this can be, if you even
ah,
try to drive or even walk, and
yes,
sometimes you can walk with the right shoes, but still
yes, yes.
you're
It's
going to slip off if you're not
yes,
careful. So
yes.
take care for those that are already experiencing this beautiful weather like me. I always call this like this is the blessing of salt. God has sent salt from heaven, and it's really just bringing it to us. So I just got a little short video of it. I'm going to post it so you guys can enjoy with me. So thank you guys so much again for being here. As we all know, this month is a very important month with a lot of great activities going on, and a lot that we need to be aware of, a lot that we need to contribute. Everything we need to contribute, but it's so important. We began with celebrating life, celebrating my life as a symbol, which is the most beautiful thing that we have been given is life. What we
Hmm.
do with that life is left to us. What are
Yes,
you doing with your life? What am I doing with my life? But I know because we are here that we all are doing something great. We are doing it together. And I still just always thank Mr. Ashmafara for what he has done here. And it's not just the people out of Unpassive, but Unpassive itself here is what has brought this so powerfully together because Mr. Ashmafara is changing the world through the face of a little young boy. So thank you guys so much for being here. And you can see us here, you should begin to guess what this means right here. This means with the pink color, right? So
yes,
and you
yes.
see I wear this too pink. It's cool anyway, so I just get so cozy here. So and we are here Thursday, October 31st. Woohoo! This is the end of October,
End
and
of the month.
made
Yes.
it. And we are going to welcome Osha in November. And so we are in the Mantle of Hope Revolution Part 245. October is Breast Cancer Awareness Month.
Mm-hmm.
Let that sink in for a moment.
Mm-hmm.
October is Breast Cancer Awareness Month. What can we all do to raise awareness among women with a focus on young girls? This is very, very important for us. And whatever we are doing here today, as always, in the other with the other topics, when they concern health, we are not doctors, like professional health doctors. We are not, but we are researching and also doing things from our own experiences. But we always want to encourage each and everyone to go for checkups at least once a year. Very important. Early detection is key to any illness, not just breast cancer, even prostate cancer, any other illness. Early detection is key. Let us keep up with our physicals. Total physical. I do it every October, so that reminds me of my birth month.
Yes, yes, yes.
So that is very important that we all mark our calendars and do it for your children and teach them so that when they are 17, 18, 19, they can begin to follow up with their own health as well. So this is very, very important. Now, October is Breast Cancer Awareness Month. What can we all come together to do to raise awareness? Or, of course, if we can prevent it, what can we do? What are the habits that we can put in place that we can prevent this from from coming? We see it every day. When I I'm helping at the St. Jude's Children's Hospital, like sending in some resources. I see those children going through a lot, but in this case, it's breast cancer, focusing
Mhm.
on women. And so we're going to be talking here about a lot from experience, from what we've seen or lived it or whatever, so that we can begin to put in place things that we can help ourselves, the women, and our young girls to prevent this from happening. So we wear pink as a sign to really respect this, honor it, and helping and really encouraging all of us to come together and do something, not just the women, but every person. You, the husband, you, the father who is at home there, you mark your calendar as well as your wife is marking their calendar, or your girlfriend. You also mark it as well and continue to remind her, did you go for your breast checkup? Did you go check your physical? Did you whatever? Even you, when it comes, the woman has to do the same. So we are in this together. Together, they will heal. We will send breast cancer back to where it belongs. So thank you
Yes.
so much. We begin with our quotes. October is Breast Cancer Awareness Month, a time to honor the warriors, celebrate the survivors, and stand united with hope. One Global Movement believes in the power of community,
Mhm.
courage, and compassion to help conquer this battle one step at a time. Together, we raise our voices for those who fight, for those who've lost, and for a future without breast cancer. Let this October be a beacon of hope, unity, and strength as one global movement joins hands to make a difference. Breast Cancer Awareness Month is a reminder that early detection saves lives, and love and support can heal hearts. One Global Movement is committed to raising awareness, inspiring hope, and empowering every woman, every young girl to live her healthiest life. This is so important for us. Remember, we talk about reminders, love, presence. This is very important.
Mhm.
And breast cancer is this month, but all other illnesses we must follow the same pattern. We must. And we know that the prostate cancer awareness too is coming. And we're going to be talking about that as well and other things. We've talked about
And
mental.
just a little bit too, I've discovered that men are also having to be mindful of their body up here now because they're also now prone to having breast cancer. So
Oh, okay. Thank you so much for
mhm.
putting that in there. Yes,
Yeah.
men are all they need to also take good care of themselves because of the dynamics of life. They are prone to breast cancer as well, if you understand what we are meaning here. So
Yeah.
thank
Yeah.
you so much for doing that.
Thank
So
you. Thank
what
you.
is so let's just go back and forth, okay? So what
Yes.
is the theme and focus of October being a breast cancer awareness month? What is the theme? The theme and focus of October as Breast Cancer Awareness Month are centered around increasing public knowledge and support for breast cancer prevention, early detection,
Mhm.
treatment, and research. The campaign typically includes raising awareness. Remember, awareness through education, raising awareness, starting with you, your home, your neighborhood, your
Mhm.
community, and then you move into the global village. We all can do this. Everybody, you know, what else can we be doing out there without doing things like this? If we
Mhm.
say we love people, if we say we want to uplift humanity. Remember, Mr. Ash Mufara was talking about a lot of illnesses in one of the O Connect webinars or Zoom meetings. He was
Mhm.
stressing a lot about how the unpassive resources or AI, artificial intelligence, is going to do a lot more to try to prevent all of these illnesses. Because as we know, among us here, we are sick. A lot
Mm-hmm.
of us are sick from one thing or the other. Nobody is being spared, but a lot of it has come about as a result of the lifestyle, the kind of food we eat, the way that we think, and the way that we treat others. Those things happen. A lot of them are emotional disturbances that, if not taken care of right now, it's going to result to other things that are devastating. And when you are sick, those that are dependent on you, what happens to them? They are sick too. They are affected. And
Yes.
those that are dependent on those that are dependent on you, the same thing happens. And before you know, it becomes a ripple effect that is affecting the global economy as we see it today. So that is very, very important, that raising awareness, educating the public about breast cancer is paramount. It's risk factors. What are the risk factors? We have to educate them. What are the symptoms? And the importance of regular screenings like mammograms
Yes.
for early detection, excuse me. And this
Mm-hmm.
has to be done every year for women and now men as well. So let us not forget to remind each other. And it is good that we're going to be talking about this here. And when the One Global Movement website gets to be running, these are courses that people can actually go there and take
Mm-hmm.
those courses, and then we keep upgrading those courses as we move on.
Mm-hmm. Mm-hmm.
And then what else can we do? Encouraging early detection that we just talked about, stressing the significance of self-examinations, regular clinical screenings. You go to the clinic, you're meeting the specialist. They screen you because they've been trained in that to do that. And
Mm-hmm.
recognizing early warning signs to improve survival rates through early diagnosis. So what is the important self-examination? I was taught that as well.
Yeah.
And
Yeah.
sometimes, the age for mammograms, it used to be I think 35, 40, but now it
It's
dropped
younger. It's
because
younger.
it's younger. It should be 30 years now, or sometimes if I were you, a young woman out there, go there as early as 25. Because why? Young girls are getting pregnant. They are also using a lot of things. They are breastfeeding, a lot of things. Not to say that breastfeeding causes cancer, no. But a lot of things are happening nowadays that can cause that. And the
At
way,
least,
now go ahead.
sorry, sister. At least you should be familiar with your body. So as you step back and you talk about the examination, your body is yours. You should be familiar with it. Anything that doesn't feel right or that's changed, it doesn't have to take up a lot of time. You just know you're showering, whatever. Know your body. Know your
Yes.
body.
Yes. And nobody's gonna know it for you. Only you. Not even your husband, not even your own child.
Nobody can know
We
it as well
have
as.
to know our bodies. I was taught, like, when you are taking a shower,
Yep.
you feel it's your body.
It's
Go
your body.
there, start right from the armpit here, and start
Yep.
feeling, really feeling deep, and
Yep.
knowing you will feel your own tissues. You will know. And
You
when
know.
something out of the ordinary is there, you
Mm,
know. So you really feel it all your breast all around, and begin and go right here, because the breast tissues also go right up here. So you feel
absolutely.
it so well. And if you feel anything that is abnormal, go in and get yourself diagnosed.
Yep.
And another way is um do not you need to know what kind of deodorant you wear. You need to know. You have to read the ingredients very carefully. For me, I recently learned it. I didn't know. I learned it last year when I went into a store. I was looking for the kind that I was using frequently, and then this lady said, "I saw. I'm the one who likes to ask questions. I approach people from nowhere, and I said, why what is the difference between this and this that I'm holding?" He said, "This one." Say, "Oh, when you see the one that is written there, aluminum, don't buy. Don't
Yes.
buy.
Yes.
Aluminum will give you cancer." Okay, ladies?
Yes. Yes.
Aluminum, even the men, don't buy. When you go to buy your deodorant, your roll on, make sure you
Mm-hmm.
read the ingredients. If it says aluminum, don't buy. If it says aluminum free, still read it just to make sure. And what I started doing is I tried to research on those ingredients to see the side effects of those ingredients. We need to. When you take care of yourself today, you'll be happy tomorrow. Don't say it's going to take my time. What about it's going to take you a lot of time to get treated from cancer? What about that? So that is very, very important. And then supporting research and treatment. In as much as we are supporting to defeat hunger, illiteracy, and poverty, we also have to support the sick, especially breast cancer. We need to support it, because if we don't support, then why are we even talking about children? When they are sick, they can't do anything, right? So promoting fundraising efforts for breast cancer research, better treatments, and finding a cure. Many campaigns also support patients and survivors by raising funds for healthcare resources. In the United States here, we and my household, we contribute to St. Jude's Children's Hospital, cancer, little child, they're going through a lot. We need to do that, no matter how small, but you're doing it. Sometimes it can't just only be money. You go with good books for the children, sit and read with them. One of our legends here, Chadwick Boseman. If you guys know about Chadwick Boseman, the Black Panther, he was the lead of the Black Panther, and he had cancer.
What's your mic, sister? It's a bit waffly.
Okay, do you get me now?
Yes, better.
Okay, good. So you go there, you play music to those children, you read books with them, you can read the Bible with them, you can dance with them. Please, that alone is a cure. That alone, because that moral support and that spiritual support and that love is the number one thing for any medication to be able to work in people's system. Because medication alone would not work. So it's for you and I. Let's do something. Let's do something. Let's even sometimes, if it's family, we shave our hair together with them so they can feel that they're not in it alone. We show support however we can. That is going to help them. So that is very important. And then advocacy and empowerment. We empowering those affected by breast cancer by creating supportive, we just talk about it. These things are interwoven into each other. Supportive communities, like community here in One Global Movement, like community in Anpase, like community like the Clean Water Supply, community like producing dolls for these people, community like cutting your hair, but make sure it is approved. Cutting your hair, instead of throwing it away, you go and get it approved, you wash it so clean, you donate it. And also really helping them with clothing and the kind of food that they need to eat. We support them that way, but more so loving them, embracing them, knowing that cancer can affect anybody. It's not just some people are not the other. So it's very, very important. And then celebrating survivors. Let's celebrate them. Celebrate those that survive breast cancer, because it is a battle, and honoring those who have passed, paying tribute to those that have passed because they could not survive. This is very important. And then highlighting prevention. Prevention is better than cure, the saying goes. Prevention is better than cure. Sharing information about lifestyle choices that may reduce the risk of breast cancer, such as maintaining a healthy diet, regular exercise, and avoiding smoking and alcohol. And I will also say that we need to stop, I don't know, even if the doctors approve it, is it necessary to try to do breast implants? We have seen the disasters of breast implants. Just like butt enhancement. We have seen all those disasters. Let us learn to appreciate our bodies the way God created us with, because we were created that way for a reason. You don't need no approval from anybody. You don't have to be so big and so muscular like another person. You don't need to have big boobs like others. You don't need that. You don't need to go. And sometimes for a health situation, and I've seen that with a few colleagues, sometimes the breasts are too big for them, and then it causes back pain.
Yes.
Now it's okay because you are not adding, but you're reducing in order to avoid further problems if you have those big boobs, So let us also watch out for all of those kind of things. And
balance, sister. It's all about balance. Again, with balance.
Alcohol, you need to know. Drinking
Yes.
in moderation. Yes,
Yeah.
balance, like you say, is very important.
Balance.
And then
Balance.
the iconic pink ribbon symbolizes, you see
Yes.
our
Yes.
ribbon here. The
Yes.
iconic pink ribbon symbolizes solidarity,
Yes.
hope,
Yeah.
and the fight against breast cancer. And it
Yeah.
is widely used throughout the month to unify global awareness efforts. If you guys notice, I have been wearing this a lot this month, So that is doing that. And at the same time, you're enjoying the beautiful pink color
Yeah.
because these people matter, right? So,
Mm-hmm.
what are some of the causes? Cure and prevention of breast cancer. We'll just be going just like we do our thing. Breast cancer is a complex disease with various causes and facets, and treatment opinions or treatment options, and prevention strategies. And let's look at a few of them. What are they, according to you? What ways what are some of the treatment that you know? What are some of the prevention methods that you know? And what are even the causes of breast cancer? Because when we get diagnosed, they're going to tell us. And sometimes the doctors are not God, they might not know too. They might not know.
They
But
might not.
the general rule of thumb is that let us eat healthily, let us exercise. But the health, number one, is our mental health is very important. What you think is exactly what is going to happen. So we start taking care from this. So when we do that, our children will also follow suit. So now the causes, genetic factors. That's the research that I did, genetic factors. Like they
Mm-hmm.
say, it runs in the family sometimes.
Yes.
So inherited mutations in genes such as BRCA1 and BRCA2 can significantly increase the risk of breast cancer. So
Yes.
these are terms, are scientific terms. It will take a long time for us to dive into it, but there are certain mutation or certain genes that cause breast cancer. And then we talk about hormonal factors, prolonged exposure to estrogen and progesterone. These are also chemicals from outside. When you expose yourself to these things a lot, it causes breast cancer, such as from the hormone replacement therapy. We know about the hormone replacement therapy, or early menstruation may raise the risk. Early menstruation. And we talk about early menstruation. Our girls are getting too mature too early because of the kind of foods that they eat.
Yeah.
And we have not trained ourselves to eat healthily. And so they're not going to eat healthily as well. So the
Mm-hmm.
kind of food that they eat, a child start menstruating at 9, getting pregnant at 10, 11, that is insane. And so we need to watch out for that.
Okay.
And so
Yes. Yes.
such hormone replacement therapy or early menstruation may raise the risk, which is, we know that. And then age, we talk about the age factor that might be a cause. The risk of breast cancer increases with age, especially after 55, ladies. 55, the risk is higher. So let us know that. But if I were you, when they say 55, I would step back. I would say 45 for myself, to take good care of myself. That's how I do.
Yeah.
So,
Yeah.
yes.
Yeah.
And then we talk about family history. Having close relative with breast cancer can increase the risk. But we can all come together to do something better. So we really, really severe that agony of breast cancer in the family. We can divert, we can turn the tables around, and it will be better instead of carrying that history on our heads,
Mm-hmm.
And then
Mm-hmm.
lifestyle factors, obesity. Sedentary lifestyle, sedentary. You know what that is, right? Sedentary lifestyle. You sitting on the couch and you being a couch potato, you're just chipping your hands in the back and then you're and you're watching TV. You don't get out to do any exercise. That is the kind of sedentary lifestyle. Or you want to go do something and you're sweating a little bit and this is so hard. And then you let go. No, that is the kind of lifestyle that we don't want. Smoking. I know that lots of us smoke. This is not
Mm-hmm.
to criticize people, but please, please be mindful of what you're taking into your system. It is very important. Remember, prevention is better than cure. And excessive alcohol consumption are linked to higher risk. Remember, excessive. They didn't say don't drink, but drink in moderation. Like Sister Yvonne always says,
Balance.
in balance. Balance is very important. And then radiation exposure. We are living in the modern world. Yeah, hey, I have to turn on the microwave. I have to do this. I have to do that. Radiation. Previous radiation treatment and to the chest area can increase the risk. And then other health conditions, conditions such as atypical hyperplasia or lobular carcinoma in situ can elevate the risk. These are all medical terms that are related to the
Yes.
cause of cancer. And
Mhm.
so we also go to locally. When you are heating up your food in the microwave, we have this microwavable bowl that you must cover your food. Please cover your food before heating up. But if you cannot heat it up on the stove, which is the best way to do, then you are in a place where you don't have that access. You can use a microwave. Make sure you cover it and don't
Yes.
heat things up in a non-microwavable bowl. Don't do that. It
Mm-hmm.
must be written there microwavable. Then just take
Yes.
any kind of plastics and heat it up and
Yes.
heat food up, it is going to cause a problem. And with
Yes.
bottled water, during summer, we know that we always carry water in our cars. During summer, don't let bottled water sit in your car. I've seen it, when you let it sit there and you go, you see it is already emitting liquid or something into your water. You see the bottle is trying to melt, and in trying to melt because of intensive
Yes.
sun, it's going to cause you a problem. I have
Yes.
to remind myself. But now, if we can get bottles for ourselves and our children, really
Yes.
good water bottles like the one that uh, uh, I was looking,
Sharon.
yes,
Sharon.
the
Yes.
Sister
Yes.
Sharon made, your water will be fresh and your water will be warm if you need it warm. So let us try that. When you buy those things, you might say, oh, it's a little expensive. It's $8, $10. It saves you more than the millions that you're going to be spending to treat cancer.
Mm-hmm.
So let
Mm-hmm.
us remind ourselves, let us buy good bottled waters for our children. They can take the water from the bottles and pour it in there. And let us
Mm-hmm.
also be mindful of the kind of waters that we drink.
Yes.
We know that the good water might be expensive, but
Mm-hmm.
let us do the best thing. You would rather treat yourself now very expensively so that later on you have and enjoy the life that God has given you. And then what is a cure? Do you have any other causes, Sister Yvonne, apart from these other ones?
No, no, you covered this. You cover them. You cover
Okay.
them.
Then
Yeah.
now, what is the cure? Remember again, I keep repeating, prevention is better than cure. Somebody said that. It's not, I didn't say that. I grew up to learn that. Prevention is better than cure. If you know that you have to go, like it's snowing here now, you're gonna go out there and you're gonna fall. And you put on your flip-flops. What are you doing to yourself? You're gonna fall. But then if you don't want to, what do? You put on, excuse me, grippy shoes that will grip so that you don't fall. Even if
Mm-hmm.
you then fall, the fall will not be so severe. So prevention is better than cure. Now, what is a cure? We talk about I don't want to say surgery first, but for me, is the lifestyle that we are living. How you eat, how you exercise, how you think, how you do things can cause a lot of problem. And then
Mm-hmm.
we talk about surgery. Uh, lump, lumpectomy, it's the kind of surgery that they call it. This is the removal of the tumor, the lump, if you the lump in your breast and some surrounding tissue. They have to remove some of the tissue that might spread to other areas of your body, or mastectomy, removal of one or both breasts. We have seen people that have their breast, women that their breasts are now men as well. Their breasts have been removed. What do they do? We support them by buying those artificial, uh, medically approved foams. It's not just any kind of foam because it can cause more problems. It has to be medically approved, and then they can wear it as bra to really, to shape up themselves well. And that is very important. And these can be very effective, but it has to be approved. And then radiation therapy, often used after surgery to kill remaining cancer cells. We've seen people go through radiation. I've taken care of people that have gone through that. So we have that kind of treatment. And then chemotherapy, systemic treatment that uses drugs to kill cancer cells, often used before surgery to shrink tumors or after to prevent reoccurrence. Shrink the tumor, and sometimes when you shrink it, it dies, or you use it after to prevent it from coming back. That is very important. And then
These,
go
but
ahead,
these are all modalities that you would be in consultation with your
doctor.
caregiver, right? You wouldn't have to you wouldn't you wouldn't just talk to other people about it. I'm assuming you would have to be under the care of your doctor, and he would discuss which one is best for you, because as you were saying, there's so many different kinds of modalities that you could use. But he or she, the primary doctor care, the oncologist, will definitely tell you which one is more efficacious for the kind of cancer that you have. Because even with the cancer in one certain area, it's different kinds of causes, as you just said. It depends on whether it's metastasized, or whether it's in one place, or you're going to do the biopsy,
Yes,
lumpectomy. So this is what we're talking about. I just want our audience to know that we're not
yes.
telling them that they have to do this. They don't
No,
have to
no,
figure
no,
that out,
no,
because they're not doctors.
no.
So you're going to have to just be listening, get a second opinion if you want. Always have somebody go with you, not just for support, but for two heads are better than one. Because
Yes,
recently I had cancer in a different part of my body, but it's the same thing. You don't ever go there just on your own, because you're in a different space in your head. You don't
yes.
want to say yes to something that you don't really feel like, or whatever it is. So it's support. Now we're talking about the support of it. You have to have somebody who is really bringing you hope and saying, we're just going to go through. It's a journey. It's a
Yes.
season. It's a journey. So thank you, sister. I mean, you were
No.
telling about the other parts that might happen to them, but those things will not be up to them. You know what I mean?
Yes,
Yeah.
yes.
Yeah.
It's not up to them, and it's not even up to us. That's why at the beginning we say you must consult a doctor.
You
We
must.
here
You
is
must.
research. We are not professionals in
And
this
we're
area.
not giving medical advice either. We're not
Yes.
doing any of that. We're just
We're not
talking
doing
about, yeah,
raising
yeah,
awareness. This is
yeah,
raising awareness.
yeah,
And it is the Cancer Prevention Month. We want to raise awareness so that people know early detection is key. You must go and consult every year for a total physical, and for your
yes.
children, especially those that are 25 years and up. And now it's not just women, plus
It's not. It's
plus
not.
men too as well.
Yeah,
So
yeah,
please, that is and thank you for saying that. And don't go alone. Take that very seriously. If you
yeah,
don't have a family, go look for somebody to go with, because you alone you will not understand. There has to be somebody that is going to help understand that with you, and
yeah,
somebody that has to also ask questions from a different
yeah,
perspective,
yeah,
so that, and sometimes even three, like we go to the hospital here with my mom, three of us, you
yeah,
know.
yeah,
Yes. So
yeah,
that is the kind of support that we need here.
yeah, yeah.
That is the kind
And
of support that we're
in,
talking
in
about.
Canada, I don't know if it's the same in the US, but in Canada, as you were saying, because some people really are quite alone, you can always call up some agency, or even the hospital might direct you to somewhere where you can get a person to go with you. This is how much seriously they're taking this. They're taking this idea of, what do they call it? But there's a name for it. But the person, advocate. It's advocate for
Okay.
you. Yeah,
Yes.
because
Yes.
they're kind of more objective. You're in fear mode most times when people say that you have cancer. You know
Mhm.
how some people are afraid.
Oh, people
Yeah,
are afraid.
yeah, and so they won't pay attention. They won't. And so the person is more objective, and they take notes. And then when they go home with you, if they do, you go over it again, and then you decide, what did the doctor say again? What is the treatment? What. They
Mhm.
can't really tell you what to do either, but at least you have a broader knowledge of what was said. It's, yeah.
Yes. Yes.
I think I might try to become somebody like that. I would like to support people in that way.
That's nice. Thank you so much. Thank
Yeah,
you. You guys heard that. And I do too. We
yeah,
like to support people in that way, because I am also supporting people. And I supported before one of my very good friends here. And how did I meet her? Years behind, the kids just graduated from high school. And I
ah,
was just driving in my neighborhood to go to somewhere. I saw this woman was so worried. And it looks like she misplaced something. She was looking. And I stopped and I said, ma'am, are you okay? Can I help you? She
yeah,
said she just left from work to come and pick up the kids from the bus stop and leave them in before going back to work to punch out.
yeah,
But
yeah.
the key was missing. I say, it's okay. If you don't mind, I am your neighbor. I live with my mom, and my home is just less than a minute from you. And so
Yes,
we went and I talked to my mom, and she let my mom come and wait there and pick up the kids. But my friend, she died. These kids were only 1 year and 2 years old. They were pooping all over us. We were cleaning everything, but which is okay because these are children. We basically raised those children. I am now a mother to those two kids. They just graduated from high school,
Yes.
and they're now in college.
Lovely.
She died, and she had cancer. She always tells me, Yvonne, please don't stay without checking on me. I say, and then she says, I have something private to tell you. And then when time comes, I say, can I come? And you tell me. She didn't want to. She didn't want to. When she died, the son called me. I cried. I said, what is all this? Very good woman and young, around my age. She died.
So in that anecdote, that story you're telling, do you think she got enough care? Do you think she took it, or was she just afraid to go any further with it? What did she do?
I don't know, because I never knew. I only knew after she passed, because I said, but when did she have? She died of cancer. When did she have it? Long, 9 years behind, and she didn't want. She said the family said she said they shouldn't tell anybody. No, tell. If you don't open your mouth to tell, you're going to suffer with it. I could have taken her somewhere. I could have.
And you need positivity. And I'm writing here and I'm saying hope must be a thread woven throughout the whole survival journey. When you don't have hope, it's a bad thing. It's worse than the disease, because many people have survived horrendous diseases and situations simply because people want them to stay alive. People support them. There's positivity around them. Someone cares. Those are all modalities that can help.
Yes.
With a diagnosis. Don't just go in isolation. It's the worst thing you can do.
And that's why we talk about, please, let's not laugh at people when they have different illnesses, because we stigmatize people, such as mental illness. Cancer, people you think talking about you like that is a terrible thing. You don't know when cancer will come. You don't know. And you say, oh, she has cancer. No. We need to support them. Nobody knows where illness comes from.
Nobody knows. Yeah.
Nobody knows. So I cried. Every time I think about it, I cried. I have to check on these kids. I tell them if they need anything from school, because they don't really speak English well. And I was the one who was speaking to the children. Yvonne, come and talk to the children. Come and talk. You're the one who understands more than me.
Yes.
But she's gone. I was so mad. I could have taken her somewhere.
Yeah.
But that's okay. But now we are learning. And when we are talking to people, let us be kind and loving. Let us make people feel that they are included, they are loved, that they belong. Because if people have that sense of, say, oh no, I don't want you close to me, or I don't love you, that is the way sometimes they stay away. Or stigmatizing the disease is what people are making other people to be quiet with their illnesses. You know? So that is very, very important. But we are here today raising awareness. We are asking for support of all kinds, more so loving, caring, and be kind. Following these people, even when the treatment has been initiated, keep following them until they survive that cancer.
Yes.
So that's what we are asking for here. So we're talking about drug therapy that targets specific characteristics of the cancer cells, and then immunotherapy, different kinds of therapy. But what is the prevention? How can we prevent it from happening? We talk about regular screening, number one. We already talked about that. Do not skip it. And it's starting so early now for women. Instead of 40, it's 30, 35, I believe. And so we ourselves, we can, even if you ask for it to be done, even when you're 28, 25, 28, they will do it for you. If you have your insurance, they will do it. Yes. Ask for those things, but make sure both men and women now, feel your body. And it's not only around the breast, but we are talking about breast cancer today. Anywhere that you feel something, report it immediately and get diagnosed. Early diagnosis is prevention. And then we talk about healthy lifestyle, which we already talk about, and then genetic testing. Does it run in your family? Or how many people in your family? Because it might not run in the family. It might even begin just with you, or it might begin you are the second person. That doesn't mean that cannot be cured.
I started getting very early, and every year, because my maternal grandmother had double mastectomy. So as soon as I started getting the mammogram, they said, you obviously have it in your family, so you're going to. So even now, every year, I still go. It's automatic. They send you a note saying it's time.
No, even if they don't send it, I put it right here in my pocket. Yes, that's what I do.
Yeah,
And
yeah,
then medication for women at high risk, medications like tamoxifen. I'm not prescribing. This is the research that I did. Or
yeah.
aromatase inhibitors. There's a lot of other things, but the doctor has to prescribe it depending on your condition.
Mm-hmm.
And depending on the kind of cancer. That's what we are talking here. But we are raising awareness. So just so you know. And then prophylactic surgery. Different kinds of surgery depending on your kind of cancer or situation is what we are talking about here. Breastfeeding. Let's talk about this breastfeeding. Some studies suggest that breastfeeding may lower the risk of breast cancer.
Mm-hmm. I know. I heard that.
Yes. And so, and I'm a breastfeeding mother. My son would not even leave the breast for almost 2 years. He refused. I was.
A big baby.
Oh, and then I was so bad because I had to go to work. He would not take it, the ordinary milk. He wouldn't take it even when you express it and put it in the bottle. Never. And I was so upset. The doctor said, Yvonne, count yourself lucky that this boy refuses the other forms of milk.
Absolutely.
You want to get it directly from yourself.
Yes.
Because this boy will grow up to be very healthy and will not, and this boy never gets sick, no infection.
And he is, because there's actually something in the breast milk that is a prophylactic, as you were saying, against lots of the things that children come down with. So yes, it's scientifically proven. It's a different milk than the one from the shelf. Different.
Yeah. And those kids, guess what? They walk so fast, so quickly, and so strong. Those kids. So if you can, ladies, if you can, breastfeed your baby at least for 6 months, please, if you can. Yeah. Unless you cannot, then we'll understand that as well. Understanding this aspect of breast cancer can help in making informed decisions regarding screening, prevention, and treatment. It's always advisable to consult healthcare professionals for personalized advice and guidance. Not from us here. We are just really doing what we did the research on, and that's what we're giving. Always consult. Even if your mother, your father, your grandmother, your grandfather use certain kind of treatment and it worked for them, of course it does work. Because I have a grandmother who is 108 now. She's going to be 100. She never went to the hospital. Never, ever. She refused. And she has been planting. She's a traditional
herbalist.
Yes, herbalist. And blood transfusion, no. You eat they just cook the grass, you drink it, within 20 minutes, your blood goes back to the same place. But these are things that she has studied. Yes. And she's healthy now, healthier than me, walking and doing everything. But make sure you get diagnosed because times change, things change, lifestyle changes. So let us make sure we consult the health professional for diagnosis. But do it every year. Don't say, oh, I'm going to pay money. If you don't pay money, wait until you test the bed of a person that is sick from cancer, and then you will know. So let's do it now. All right. Thank you. I'm happy. I think, these are the 3 important things that we had this month. Breast cancer, women business month. And what else did we do?
I think, was it this month for bullying or was it last month?
Bullying, this month too. Yes. Yeah. So we did the important things that we need to do for our children.
Yes, we did. Yep. We covered the whole spectrum.
Yes. I drop my phone. I break my phones a lot. I don't know why.
I'm glad you have a good cover on it because that should protect it. Yes.
Yes. Yeah. So, all right. Let's go.
So you saying we're talking about awareness in women. So we're going back to the wearing the symbolic and iconic pink ribbon because that's not only support, it's also a conversation starter for if somebody asks you, because some young people are not, they're not versed with all that's going on around them. So when they see you with the pink ribbon, because I mean there are so many ribbons now, so many different colors, the yellow for this and the so on and so forth. So they will ask you about that, and then you can say, how do you make sure that you're healthy, and who would you turn to if you thought something was, you know what I mean? Because we're talking about young people who are not, as I don't know, efficient as we are, whatever it is. They're just going about doing their business, running out with their friends. But if you tell them that this is what this stands for and this is what they need to do, don't smoke if you don't. Stop drinking all that pops and soda. I'm going to say that. I don't care what anybody says. Stop drinking all that sweets. And I like sweets, but still drink water every chance you get.
Yes.
And stop with the pop, and don't overdrink, and don't take up smoking of any kind if you don't already do it. And if you have doing it, stop it, because those things are chemicals going into your body. Where else can they go? And they cause problems.
Yes.
You don't know what they might, yet nothing might happen, but you don't know what they might trigger, and you don't really want to deal with that.
No.
Right? So we just have that kind of a conversation with a young person, not in any pressurized way, not in any condemning way. If they ask you what that ribbon is all about, which I have been asked, not this particular one, but I have a ribbon, the ribbon that they have for the cancer. And I've been asked about, what is it for? Young people. If they're 5 and they ask, it's not too young. You tell them what it's for,
Oh, yes. Oh, yes. Oh, yeah. They will understand. They know it. And you'll be surprised that after a few years, they'll say, oh, I learned this from mommy or daddy, or I learned this from this person about this. Those kids are very smart. They keep information.
Yep, they do. And they might even tell their little friends. And so we spread the word that way. And as you said, we support by donating, and we support by actually going and spending time with somebody who might not have any company. Those kinds of basic things we can do. Volunteer at treatment centers. They're always looking for volunteers, because the staff is only there for medical things. They have to go on to the next person. But what about the person who's left there now just totally lost? Because to them, to most people, it's a horrifying and frightening diagnosis.
It is. Yeah, I took care of one lady until she passed. My only fear, I was so afraid that she shouldn't pass when I'm there. Please. But
she was in hospital, or where was she?
She was discharged from the hospital to home, because I think it was terminal,
Yeah.
So yes, I had to take care of her. But then after some time I went there, she was gone. But they need us more than ever before.
They do. You do. And I mean, those are the kind of simple little things you can do. It might be a little bit hard on you, because watching somebody who, especially if, as you say, the doctors have told her that it's it, but still, you never know. They might need just somebody to cry with, to talk with.
And just so you guys know, the doctors, they determine the diagnosis, but God determines the prognosis.
Absolutely.
For every illness. Not to say that the doctors don't know, they know, but the ultimate determination comes from God.
He's the official healer. Yes. He's a healer. He's the ultimate healer. And many people have said that. And look online, and you'll see people who said the doctors
gave up. Look at my mentor, Mr. Les Brown. Mr. Les Brown had prostate cancer. And they gave him 6 months to live. Oh no. He said, no, Lord, I have so much that I'm
to do. Yes.
Time I will serve you. I will do this thing. What did he not do? He somersaulted. He did whatever. And he says, I want to leave. I have 11 children.
Yes.
I want to leave. And he's leaving.
Yes.
And this has been like 50 years ago. He's still there.
Absolutely. So I'm not disrespecting the doctors, but the good ones actually will tell you that they are providing the treatment, but the Almighty is the cure.
Oh, yep. And I've heard them say that.
I've heard them say that. I've heard them say that. Yes.
Yes. And it depends on you too. They said it depends on your way of thinking.
Yeah.
But if you think healing will surely come. But if you think this is it, that is it. So I think a lot of people have survived cancer, just like other illnesses. You are a survivor. It might not be breast cancer, like you said, but look, I am
twice. I had thyroid cancer, and then I had cancer here in the tummy here, and that was just last year. And it's partly here how you take it. You say, okay, this is what you're saying. What are we going to do? And they say we're going to do this, and I say okay to that, and it's done, and that it's done.
But see, God knows why. Our path in life have been mapped out. Now God says, no, you're not going, because one global movement is here. do your clean water supply together with One Global Movement. See, everything happens for a good reason. So, ladies and gentlemen, when things happen, think positive and begin to put things in place. You like affirmations. I do that all the time. They said,
Yep.
"Oh, you can do." I said, "Oh no, I am one of the smartest women in the world." I was a
Yep.
child. I said, "I'm the smartest girl in the world. I can do this. I can." And
Yes.
I'm going to do. They say, "Oh, your mom and your grandma are poor." I said, "No, they're not poor. My grandmother has a private plantation, a sugarcane plantation, a water leaf plantation. My mother has this. My mother is hardworking. My mother is beautiful." All those things are here. They're right here. And it is
Yes.
working. So
Yes.
when you are diagnosed with something, think heal. Think that you've gotten the treatment that you need, and it comes first from the one that created
Yes.
us.
Yes. Yes.
You know, and
Yes.
then the doctors, like she said, the good doctors will tell you that. They'll tell you. And then after
Yes.
that depends on you. And ladies and gentlemen, a lot of time those things go away. But still follow your treatment. Don't just do that and sit quiet.
Absolutely. That's what I was going to say
Yes.
to you, sister. I said, please get the proper diagnosis, follow the protocols, and then if you pray or meditate, believe.
Yes.
Believe.
Yes.
Yes.
Yes, and like we're saying that some people say some pastors they'll fool people, young people in particular. Pray, pray, pray. Miracles are coming. No, no miracles come to you when you pray and you don't work.
Yeah.
You have to take action.
Yeah,
It's the
you do.
same thing that we are talking here, the
Yep.
same concept.
Yep.
So things happen, but believe.
Yep.
Believe, believe. Believe to see it. Don't see it before you believe it.
Yep.
So thank you guys so much.
Thank
we
you,
we
Joanne.
congratulate, clapping for those that survived breast cancer and those that did not. We also remembering them that they fought the good fight.
Yes, they did.
And so
Yes,
we
they
thank
did.
everybody here.
Amen.
And if you
Amen.
have anybody in your family that is going through this, please, our love and support goes to them. And if it's okay, let us know here, because when we know how to support those kind of
Yes,
people.
we can pray. We can do what we can. Yes,
Yes.
absolutely. Yes.
All right. Thank you guys so much. And I love you all here. Let's go. Greetings, everyone. And thanks for joining us again today. We appreciate your support. Thank you. And please join in the discussion about how to support and raise awareness in young women.
Mm-hmm.
And of course, our brother, Sir Ashok Kumar, thank you so much, brother, for your staunch support and your determination to be here to support children worldwide. Thank you. And we have Sir Raul Zehab. Thank you so much, sir, for being that support behind our children. As always, we love and appreciate you. And of course, the managing director is here. Hello, hello, everyone, and welcome to One Global Movement. Speak with Heart today. Thank you. Things are happening with the OES. Some can log in, some can't. Be patient, folks. They are working a lot they are working a lot of all folks are spreading panic and misinformation. Just be patient until we hear from Ash. Thank you so much for saying that, John, because I have been contacted a lot and I don't want that. And they are talking to you with fear, with uncertainty. They're talking with you like they lost something, that like, oh, this is not going to work. I don't want to hear those things, because it is our attitude that is it's making Mr. Ash go through all of this. I have not succeeded to log in, just so you guys know, not even one account yet, but I know that patience, they're working on these things. Let us not ruin things. When they say take time, let us take time. If they say take time to log in, if I were you, the way I do it, I want to ask some other people to go and log in, so that I help them first, so that we don't just go en masse to log in. That is not going to work. So
right, exactly.
Do not call. I'm sleeping at 2 a.m. Somebody's calling me about.
No, don't take those calls. Because our attitude determines our altitude, and we want to go to the top, as Mr. Mufara said. Let us give him the patience and time that he needs.
Yes.
I mean, he's brought it back this far. He's going to do it or die, he said. Just believe that. Leave it alone.
There you go. Thank you.
Gosh.
Thank you. And then I know our beautiful sister Melanie, why are you there? We are expecting you here today again. Now you started Christmas with us. All right. But thank you so much. You're contributing in the chat as well. Good afternoon to my dear sisters, Yvonne Mundih and the two twin sisters, right? The two Yvonne and also Mr. John B. Thank you so much. Listen more. Listen mode only for me right now. Okay, we understand that. All right, but thank you so much. Thank you.
And John will tell you why. Read what John has to
Yes.
say.
Hello, Mel. I know you will be in listening mode today, having just had some dental work done. Hope you are feeling okay. Okay, Melanie, that is so nice. Take care, okay? Get some rest and don't over talk. You know that, right? And yes, thank you. And just eat the soft foods.
Yeah.
All right, John. And hashtag One Global Movement, hashtag Speak with Heart, hashtag JJ Tinman, hashtag Big Heart, hashtag Unpassive, hashtag Unpacilicious, hashtag Ashmufara, hashtag Resident Baritone, hashtag OES. Thank you.
Mhm.
And hashtag Managing Director, hashtag One Global Movement, hashtag Speak with Heart, hashtag JJB Tinman, hashtag Big Heart. You have a big heart, John, that's for sure. We know.
Mhm. Mhm.
And then let's help raise awareness in young women about breast cancer. This is breast cancer awareness month. Yes, it is. And beautiful Nancy, you couldn't come to the stage as well? No worries. No worries. We know that you will do when time permits you. Hello, families. Welcome. Welcome to another session of One Global Movement Speak with Heart. Thank you. And let's go down here. We have Ama Chandra, how are you? Thank you so much for those beautiful emojis. We highly appreciate you for supporting children and young people worldwide, and today specifically young girls to raise awareness against breast cancer. Thank you. And Didi the Pogdash, how are you, sir? Thank you so much for joining us again today. We highly appreciate you. Thank you. And Nancy is bonjour, John. You need to learn French, okay? You need to. But that's exactly what Nancy is saying right now. Bonjour, John. Happy to see you. I'm teaching you French language. Happy Thursday. Lots of love. Bonjour, John means good morning. Okay. So let me be the interpreter here at least. Okay. Thank you. Thank you. And John says hashtag breast cancer awareness month. Yes. Yes. And I'm going to go out today to the clinic. I'm going to go there. So I'll be speaking to people about this. So
Yeah.
very important. I want to make sure that I go to some of the grocery store because they're going to be saying, oh, this is beautiful. Then I have something to tell
Yes.
them.
Yeah, absolutely. Yeah. Yeah.
And okay, let's go down here. We have our beautiful sister Sanju Ashmira. How are you? Thank you so much for being one of the supporters here for Breast Cancer Awareness Month for our young girls and women too, and
Mhm.
mothers. Thank you.
Mhm.
Everyone now.
And men, everybody.
Amen.
Everybody.
Everybody
Yes.
now.
Yeah.
And Diraj Gogi, how are you? We miss you, but you came again today. Thank you so much for being here. We highly appreciate you. Let us raise awareness for breast cancer and for One Global Movement so they know what we are doing here for children. Thank you. And Nancy says, yes, my sister, October is Cancer Awareness Month. I encourage every one of us to get checked up in a timely manner. Women and men and children, we will be able to save more life. And just so you, a reminder, Nancy is a nurse. And I
Yes.
know she knows these things very well. And if you need some advice or something, Nancy will be in a better position, nursing, to let you know. And I know she will always direct you towards the right health professional. So Nancy is here. That is a good resource for us to utilize. Thank you so much.
Mhm. Mhm.
And we have Sir Ashit D. Sangma. Thank you so much, sir, for your persistence in supporting children worldwide. We highly appreciate you. Thank you. And let's go here. We have our beautiful Kenitha. How are you, Kenitha? Thank you so much for being a part of us here, and our love to the rest of the Momin family. We highly appreciate you for representing the Momin family here. Thank you. And let's go down here. That is true. That is true. Men have to also be aware of the possibility of breast cancer. Thanks, Yvonne. That's true. That is really true, John. Thank you so much. Thank you
Mhm.
for emphasizing that.
Mhm.
And Kenita, special personalized greetings to you from the managing director, and welcome to One Global Movement. Speak with Heart today. We love having you here. Thank
Yes, we do. Thank you.
Then Deblina Sinha, how are you? Good topic, excellent discussion. Thank you so
Yes.
much for that inspiration. Thank you. And
Yes.
our beautiful sister who is in a listening mode, who is eating some porridge pap so the teeth doesn't hurt. Melanie, be
Porridge.
proactive by maintaining a healthy lifestyle, scheduling regular screenings, knowing your family history, and educating yourself on breast cancer risk factors and early detection.
Yes, yes, yes.
Early detection. Thank you, Melanie. And
Mm-hmm.
self-taught on breast cancer involve researching risk factors, treatment options, early detection methods, and survival stories to empower oneself and others in the fight against it.
Absolutely.
Yes,
Yes,
and
it's
I
a
will show some pictures here to show the women and other people that have survived breast cancer after this. Thank you so much.
right, right, yes.
And John says, yes, 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 John. JJB Teen Man.
Big heart.
Hashtag unpassive, big heart, hashtag Ashmufare, hashtag unpersilicious, hashtag resident baritone, hashtag one global movement, hashtag speak with heart, hashtag global world changes.
Mhm.
How is Mr. Milo doing? John, I've not really succeeded to talk to him because he has maybe he's too busy or something. He's unable to reply. Thank you.
Yeah.
And Alam Hussein, how are you? If you're new here, you're welcome into this global family. We highly appreciate you for joining us here from Bangladesh. Thank you so much. We appreciate you. Please get others to join you so that we can do this together. Thank you. And Maria Jars, of course, is here today. Thank you so much, sister, for being a part of this awareness campaign today. Thank you. And Tosha Kanti Saka, proud founder of Unpassive. Yes, sir. We are all proud founders of Unpassive. And thank you so much for joining us here, especially today, for raising breast cancer awareness among women and young girls, and so among everyone else, not just them. So happy Diwali. Thank you. Happy Diwali. Same to you. Thank you. And we,
What's your mic again, please?
okay.
Yeah.
Hello, Shah Bajaj Alam. Thank you so much for joining us here today. If you're new, you're welcome here today. We highly appreciate you. Thank you. Come again and encourage others to be a part of what we are doing here. Thank you. And then change your underarm sticks. It may be a bit more expensive, but it's worth it. Avoid those plug-in scented air fresheners. Avoid aerosols or too many scented stuff. Thank you, Melanie. Thank you. Thank you so much because those things too can be a cost, especially some kind of perfumes as well, roll-ons and all. Thank you so much. And we have our firefighter brother, Cecil Wyatt. Thank you so much, brother, for being a part of this global movement that is helping women, children, and young people, and for being present here today. We all know that we need to remind one another at home, our significant others, our families, to go for screening at least once a year, not just for cancer, but you have to name it. Is it cancer? Name the things that you want to be screened for. They need to check your heart, they need to check your liver, they need to check your kidneys. They also need to screen you for cancer of any kind every year, once a year. And sometimes they're very good. They'll send reminders, like our sister said before. But if
Yes,
they
yes.
don't, you are your own reminder. Write it down. And
Yep.
usually around your birthday date is very important because you will not forget.
Mm-hmm.
And Cecil Wire, hello and welcome. Nice to have you back again. Bring some other Harmony Hub folks with you. Sometime I'm trying to get to check us out. And bring some more firefighters with you if you can. Right? The young firefighters. So thanks, John. Thank you. And Yusuf Adu is a little late today, but better late than never. Welcome. Thank you, John. Thank you. And then and Melanie said diet include greens, vitamin D, walk as frequently, water, and more water. There is a lot that we can do. And sour salt. Sour salt is a fruit that we grow in tropical Africa. and we have it in our orchards. We have it, and it helps a lot with cancer. You can eat the fruit; it's so yummy. You can eat it as a fruit. I think they grow it also on the islands. You eat
Yes.
as a fruit, and then the seed inside, you can grind it and still use it as coffee, like just like coffee grinds,
Tea. Yes.
as
Yes. Yes.
tea, as tea. And then what else was I gonna say? The leaves
The
from the
leaves.
sour salt. You dry them, you store them, don't spray any preservatives on there. You keep it at home, you boil it and drink as tea. I have it here. I have the leaves and I drink it almost every day. This is my tea. Very good. Instead of
Absolutely.
buying teas that are as a lot of preservatives have been spread on there, you do
Mm-hmm.
something that is natural, that is going to keep you healthy and your family.
Mm-hmm.
Thank you so much for saying that, Melanie. And Saddam Sahar, how are you, sir? If you're new here, we welcome you here. Thank you so much for joining us here from that end of that part of the world. We highly appreciate you. Come again and encourage your family and others to also be with you. Thank you so much. And and then Melanie says, huge one is stress. We always talk about stress here.
Mm-hmm. Mm-hmm.
And there is no cure for that. You can cure, you still go back to the same mindset, the stress comes on again. So stress is good. We were born with that, but there is stress that is good. Like now, we what we are doing here is stressful. To do the research and come here to do all of this is stressful, but it's good stress, the kind that you're happy to do it and you want to do it even more. But let us avoid stressing over things that we have no control. If you cannot control a situation, control the way you react towards that situation, and you will just be fine. All right. Like now, people are stressing over one passive and trying to say it has to work, it has to work. No, it takes time. It takes time. You and I are sleeping. Mr. Ashmufara, I bet you he's not sleeping with the building team. They're not sleeping. And we need to think about them instead of just thinking about me, apples, apples, apples. Without the right mindset, you're going to stress yourself out for no reason and start developing problems. That's what,
Mm-hmm.
yeah. So thank you. And we have MD Alodine. We miss you, and you're here today again. Thank you so much for being here, and we love you with all the stars. Thank you so much. And Sir Yusuf Hadu, thank you so much, sir, for always being a part of us here. We appreciate you. Thank you. And let's go down here. And we have T2. T2 Chandra Sankar, thank you so much for being a part of us here today. We highly appreciate you. Come again and also spread the message to others. Thank you. And Nancy says, families, what an educational topic. Learn how to protect ourselves from exposure to cancer. We might be doctors, have different kinds of certifications. That doesn't stop us from learning. I love OGM. I love
Mm-hmm.
you too because you're a contributing factor to here. We love everyone that is contributing here because this is
Yeah.
what O Academy is all about. O
Mm-hmm.
Academy is really coming together to educate one another, not imposing our own values and way of learning on other people. This is
Yeah.
exactly what we are doing here, Nancy. And thank you so much for being a contributing factor. All right, let's go down. Hello, folks. Hey, folks. Give One Global Movement a big thumbs up. And then a big One Global Movement channel, a big thumbs up, like this. Up and subscribe and click on the notification bell. Ring that bell. Ring it hard. Let us hear it here for notifications. Thank you so much, Don. All right, families. Again, we have to uplift each other. I don't say I say to come here in the chat to expose your private business, but if you have some concerns, look for someone in the group. Call them. Ask for support. Yes, we have. If you don't want to talk to me, that's good. You have to go with who your heart tells you to go with, and that is perfectly fine because that's the way we should operate. Talk to somebody in the group here if you're having some challenges or a child is having some challenges, or if you want to talk to a young person, we have Ambassador Pavmi Verman. She is very good. She is a mindset coach and she is a speaker. She knows a lot about this and she's speaking from her own unique story. All right, so thank you. And Kido Mogazeza, how are you? If you are new here today, you're welcome here. Are you from South Africa? Well, just a question. Thank you so much for joining us here from wherever you're joining us. We highly appreciate you. Come again and spread the gospel to all areas of the world and let us support our children together. Thank you. And this is the Facebook page link. And we want to get to that point where we will revamp this link so it can be shorter so people don't think that it's a scam. But please, if you can, go to Facebook, our One Global Movement Facebook page, and like and follow so that we can get more resources. Thank you so much. And and Nancy says, we are family. No, I usually go to Canada, but no, if I am going, I will look for Queen Yvonne's number or Queen Melanie to tell them I'm coming and I need food. That's what families. Yes, I do that too. I need to eat, okay, before I do something. That's what we're going to be doing, Nancy. Also, we just pay when we know their addresses. The next day, us start ringing the bell because we are brick and mortar, right? We just go.
That's funny.
Yes. And then Melanie says, we need a lot of people to encourage others. Certainly, Melanie, certainly. And that's why we are here because, hey, ladies and gentlemen, we are not the same. We will never be the same. We will never go through life the same. And therefore, we just ask that we all treat each other with kindness, with love and decency, not looking too much into the character of that person unless they're harmful. If they're dangerous, it means they still need more support and help. It means something is not right. So let us encourage, let us build rather than tearing down. And let us come together to do that because I'm not 100% perfect. It's only God that is perfect. Sometimes
absolutely.
I can't, and I will be wrong. But I also trust that you guys will correct me and help me here. And we do so for the same with love, not just correcting to laugh at people or to look down on people because nobody knows it all. And this is what Melanie is talking here. Thank you so much.
I think you had a topic the other day about correction versus encouragement. I think I saw that somewhere. Do you have
Yes.
Yeah. There's a difference. Encourage somebody. You can point out that this wasn't done correctly or whatever it is, but the whole idea is you're trying to build them up to do it better because that's what we're all supposed to do.
Yes. Yeah, thank you so much. And I think that topic is coming up. Hopefully, you're going to be the one. That's your topic.
Of course it is. Oh dear.
You see how quick I just pick on that quickly? I said,
I know you just jump all over me with that.
When I come here every day, I feel good saying hi to all of you. And I am happy knowing every one of you is fine because if you were not, you would not be here. The weekend, I always try to call a friend. Yes, I do a lot of things during the weekend too.
Yeah.
Even though sometimes people say the weekend is a me day, I still don't respect that though. Sometimes I get so stubborn and I still call. Like Sister Yvonne, I say, no, I know it's the weekend, but you see, and then Nancy, I will be calling, and then I'll be calling other people. Sometimes me and John Barilla, we are into it, So
that's okay, sister. We are supposed to be together like that, Yeah.
Right. And we have Sir Kayandari Srinivas, who is always here as one of the strong supporters for One Global Movement. Thank you so much, sir, and happy Diwali. Thank you. We have some beautiful pictures we're going to show about that too. Thank you.
Mm-hmm.
And both women and men, please do some palpation. Palpation. Emulsify the node and glance with natural olive oil. Ooh, that's good. You can just put it here and just
Yeah.
That's good. Thank you so much, Nancy.
It's Melanie.
Melanie,
yeah.
Okay, thank you. And then Nancy said, when you call someone just to say hi, you don't know the difference that makes in someone's life. It's a good feeling. Let's try to call at least one person a day. Just say hi. 1 week, come back to tell us how it went, right?
Mm-hmm. Yes, that's what she
said. And I think I talk to more than how many people a day? Every day. If I don't, they're calling me. So they help me to call me and then we can just talk too. Right?
Yeah.
Thank you so much, Nancy. And One global movement, everyone founders, happy Diwali from India. Thank you so much, sir.
Happy
Happy
Diwali.
Diwali. We are celebrating light. Light is love, and love is what?
Right.
Laughter. Thank you so much. And
Mhm.
let's go down here. Okay. Sir Madan Mishra, thank you so much, sir, for being a part of us here today. If you're from India, happy Diwali. Thank you so much for being with us here today. And hashtag One Global Movement, hashtag OGM, hashtag Support Breast Cancer Awareness Month. Yes,
Yep.
that's a
Mhm.
very good hashtag that we need to put online for people to see. Thank you.
Yes. Mhm.
And then yes, soft food for me today, sisters. Plain chicken soup. Yes, yes. And there was a way I was sending you some homemade pap from Africa, which we make it here ourselves for people that have mouth work done.
Yeah.
Yeah,
What is it? Homemade what?
homemade pap. It's like it's called pap, like pap, but not so like pap. Is made from corn, organic corn. That
Okay.
you ferment it and then you grind it and then you sieve it in the store. If you go to Cup Food, it's like powdered, but this one is homemade, it's fresh, and then you drain the water from it every morning. You continue to scoop it out and then stir it in water according to your consistency.
Ah.
There, or you can put a little bit of cane sugar, but you can also sprinkle a little bit of lemon and mix it up and eat.
Oh,
Yeah,
okay.
yeah. You don't worry, you eat someday.
Okay.
I love to cook, okay? If I
I
see mom
noticed.
eat, I'll cook.
I noticed.
And then we have John says, Taib, hello, hello, welcome.
Yes.
Welcome, Taib. How are you? Thank you so much for being here today. We have Manojit Karji. Thank you so much, sir. Sorry, ma'am. We are very busy today due to Diwali Light of Festival in India.
Have fun. Celebrate.
Happy
Yes.
Diwali! We are going to show some beautiful pictures to celebrate with you guys as well.
There you go. Mhm.
And let's go down here. Okay, I think that's it. That's it. And John says, Majid Kaji, hello, hello.
You said
Yes.
it again.
Okay. Let me bring this picture so that we can see. We're going to mix some of them with the ones of yesterday as well, because this is the month. This is the end of the month. Let's see what we can do here. Share the screen. I am just going to be an expert here.
Of course.
Okay. Now, okay. Now let's raise awareness together to help defeat breast cancer and prevent it before it comes. Do you guys see that?
Yes.
Yes. Yes.
Mhm.
Yes. Yes. Okay. Now I am going to try to remove this from the screen, go back and start all over. Then it will let me come with the other ones. Just bear with me, please.
Mhm.
Oh, there we go. Yeah, it's a trick here. It's the
Mhm.
Breast Cancer Awareness Month 2024. Let us
Yes,
raise awareness, awareness, awareness is very, very important.
it
And
is.
we have a good morning. Let's celebrate the sound of laughter, the glow of
Ah.
positivity, the warmth of love. Happy Diwali. Look at the children.
I
Oh my God.
know.
They're so colorful and beautiful. They are
Yes.
laughing.
So happy.
Very,
Woohoo.
very happy. Yes, yes, yes. And let's go here. It's still the same. Happy
Oh,
Diwali
wow.
to
Look at those colors.
our
Woohoo.
brothers and sisters in India.
Mm-hmm.
Okay. Oh, wow. A lot of things. Now I will
Yes.
show the ones from yesterday. Global warming
Global
was a very
warming.
important topic. And be a friend, not a bully. We talked
Yes.
about that this month. That is very, very important. You look at the
Mm-hmm.
kids, they are standing against bullying. That is very, very important for everybody here. And you see types of bullying, so many: verbal, physical, social, cyber, a lot more. And
Yes. Yes.
different more, they keep coming. Bullying
Mm-hmm.
and stress. Remember, do not
How
see
they're connected.
somebody, you keep quiet. It brings stress, and stress is related to causing cancer. That is very, very important. So
Yep.
let's think about that. And then stop bullying. Look at are you happy that she's crying? Be a buddy, not a bully. Let us be friends with one another, not
Yeah.
bullying, because anything that we do is going to cause other difficulties in our lives, and we don't want that, right?
No, no, we don't.
Okay, let's go here. We talked about save our planet from heat. This is one of the important thing, because your planet is your home. Our planet is our home. If we do not help it, it is not going to be good on our bodies. And so let us come together to save our planet. One of the things that they talk about that was so down to earth was carpooling. But you don't carpool with somebody that you don't know. You carpool only with people that you know. Very
Yep.
important.
Yep. It is.
Good morning again. Look at the smiling faces. Look at the One Global Movement wearing the One Global Movement uniform.
Look
Good
at them.
morning. And they're so happy together. You see that?
They're so cute. Oh
And
dear.
the other one is say, I have greatness within me. See that?
That's right. We
Yeah.
should tell them that every day. You have greatness within you. What would it be today? Yep.
Yes.
Every day.
And then you look at this National Women's Small Business Month. We talked about that yesterday. And
Yesterday.
look at the little youngpreneurs. Look at that.
Yep.
They are
Exactly.
ready to take the world by storm. And the next generation will always surpass the previous one. It's one
Yeah.
of the never-ending circles in life. See
Yep.
that? Yep.
Absolutely.
So beautiful. And then we have this again. Look at these young girls, National Women's Small Business Month. These girls, they're already learning how to sell things. They're doing things online, and they are also, some are even producing dolls. Some are producing beads,
Yes.
Melanie,
Yes.
like those that
Yes.
you showed yesterday. So it
Yes.
is up to us to encourage them. I'm trying for these beads to come from Cameroon. It grows in the wild, beautiful, so that I can start a beads program so that we can give jobs to these young girls,
Yes. Yes. Exactly.
or they can even open their own places. We support it if they know how to do it. They can open their own businesses.
I was just going to say, because you see how when they're so enthused, it
Yeah.
won't be hard for them to just take it step by step and just become what they want to become.
Yes.
Don't put any limitations. Don't put our head thing on. It's hard. It's technology. No. If they want to try it and do it, you'll be surprised how easy it will be for them, simply because they have the passion for it.
Yes.
Yeah.
Certainly.
Mhm.
Certainly. Thank you so much. We already saw that one. And let me see this one. We did that too as well.
Yeah, you're going back. Yeah, that's
And yeah,
I
yes,
love this
they're all
one.
done. I think these are all the things, because this is the last one here too. Happy
It's
Diwali
so
to my brothers and sisters in India. Happy Diwali to Ambassador Pavni Verma. Happy Diwali to our little boy. I've forgotten his name right now. That our ambassador, that 5-year-old. Yes.
yeah,
Happy
yeah.
Diwali to everyone. We love you all and know that we are together in this. All right. Thank you
Yes.
guys so much. Let me take this off the screen. And thank you guys so much. We have one more day to go, and then we go to enjoy the weekend, and then we gather good information. We gather good stories from people. I'm always encountering people. It looks like God just pushed people my way, like they know what we are doing, and they come. Today, I had somebody call me. It's a lady that I was referred to by by my real estate agent for the One Global Movement store. And this
Right.
lady is more than nice. And now she is teaching me how I can do this with the government, doing helping with One Global Movement through WIC and through other government programs, so that I can buy the registrar that is going to. I'm like, who? I said,
Yeah.
okay, now you just put yourself in good trouble right now, because I don't know these things. I would like you to be mentor for One Global. He said, yeah, we do this together. I said, yes.
If you don't ask, you don't get. So there you
Oh
go.
my gosh, she knows. I said, mind you, we're going to be traveling a lot around. We said, yeah, I'll travel. She's a designer, an architect.
Oh,
Imagine
wow.
building communities for single mothers and children. Imagine
Yeah.
having the designer.
Yep. You're assembling all the folks you're going to be needing for when you say go, 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 go,
Yes.
Yeah.
And she might as well just travel to Cameroon to design the big plan for.
Why not? Why
for the
not?
space. Yeah.
Why not?
Wow. Thank you guys so much. Sister Yvonne, thank you so much. I so highly appreciate you for what you're doing here. I highly appreciate the managing director, everyone here that is contributing to it. We all here matter. We all
Yes.
here are playing our role, no matter how small. There is no one person here that is doing it better than the other. We are all
No.
doing better. And thanks to Sister Sharon again.
Yes,
She's
sister.
the amazing graphic designer. When you see me showing those things, I don't
Yeah.
design any of those. She does. So
Ah.
thank you guys so much. I love you all, and let us continue to support children to defeat hunger, illiteracy, poverty, homelessness, abuse, and all other social challenges that face them worldwide. I love you all, and until tomorrow, do you have something, sister?
No, we love you all. Bye
I
bye.
love you. Bye bye.